Good morning, everyone. Thank you for joining us for an overview of the Justice Center on this fine Wednesday morning. My name is Davin Robinson. I'm the Deputy Director of the Office of Outreach, Prevention, and Support, and I'm joined by our Executive Deputy Director, Laura. You want to say hello?
Thank you, Davin. Good morning, everyone. I'm Laura Darman. As Davin mentioned, I'm the Executive Deputy here at the JC. Davin and I have both been here approximately 10 years. Davin was with CQC before the Justice Center, so we're excited to meet with you today to give you an overview of the Justice Center processes, and also we hope open up a good line of communication moving forward. We've been talking with some specific providers about feedback regarding our investigations and also with OCFS, and we just want to reiterate that this is a partnership. We can't do this work without all of your cooperation, and we want to make sure that we approach our work in a way that is supportive to the really challenging programs that you all operate. So I think we'll kick off with kind of a broad overview, and we're going to stop at the end of each section to make sure if there are questions. I think we're monitoring the chat feature, so that's another way that questions can be relayed, and we'll do our best to tackle all of them.
Okay, all right. Thank you, Laura. I will now share my screen, hopefully successfully.
Yes. All right. Now let's see. I think, oh no, it's not going to let me. I thought it was going to let me move. Okay, so you're going to have to be my prompter, Davin. So
yes.
Thank you. So I thought I'd start with kind of how the Justice Center came to be. And many of you may already know this, but I think it's always helpful as kind of a fundamental reminder of how the agency was created. Many people may recall there was a pretty significant series of news articles in the New York Times that really detailed some of the abuse and neglect and just challenges with the incident management system across New York State, particularly for individuals that are defined as vulnerable, receiving services and programs that are licensed or operated by the state. So some of the things that were really, I think, highlighted when Clarence Sundrum wrote his report in the aftermath of the New York Times series were a couple of these key highlights. Impossible to prevent staff that committed bad acts from moving from one facility to another. So we would have folks that were committing pretty egregious acts of physical abuse or sex abuse, and there was really no way to prevent them from working in another setting. They could be fired in one facility but moved to another one with really no way for the system or the people hiring this person to know that history. I think the biggest thing, I'm a lawyer by training, although I like to say I'm a recovering attorney, is that there were inconsistent laws, rules, and regulations and standards across the system. So because all of you work in a licensed and certified setting, there are a lot of rules that we all have to follow, but at the time, there was really no consistent thread throughout those facilities or providers, specifically when it came to, there was no uniform definition of abuse or neglect, for example. There was no mandated reporting of abuse. There was mandated reporting of child abuse, but not other kinds of abuse that could occur in these settings. And because there were these inconsistencies and there was no real system to track these incidents, there's really no capacity for statewide oversight. And I think really importantly, no way to predict trends or ways that we could develop abuse prevention tools. So it was very much a system that really operated within each state agency, if that. Not every state agency had incident management protocols. So those were kind of the gaps that were identified and really the key driver behind, at the time, the unanimous passage of the Protection of People with Special Needs Act, which is the statute that created the Justice Center. Davin, next slide. So we always like to talk about our vision, and I think that's particularly important this morning to underscore that our job is not just to protect service recipients or individuals receiving services from abuse and mistreatment. It's also ensuring that we're supporting the people that do the work every day. And I think one really important way to do that, and I hope we can accomplish by the end of our session today, is making sure all of you know what to expect during an investigation, what are your responsibilities as mandated reporters, and what are your rights to due process throughout an investigation by the Justice Center. And by approaching our work in a way that is transparent, consistent, we hope to achieve this vision as we move forward. Next slide, Devin. So I also think it's important I always like to know how I fit into kind of the bigger puzzle piece. So I think it's good to know, what does the Justice Center have jurisdiction over? And I always tell people who don't know a lot about our agency, it's complicated and it doesn't follow the person, which can be really confusing, particularly for family members or just anyone receiving services who might think that they're protected by the Justice Center. We only have jurisdiction in settings that are licensed, operated, or certified by the agencies you see on the screen. So not surprisingly, the bulk of our work is in the OPWDD system. We have, a lot of people that receive services in that system who receive services 24/7. So, it's like on any given year, about 60% of our work is related to OPWDD. And then it sort of follows the Office of Mental Health, Office of Addiction Services, OCFS, which is your license and regulating entity. And then we have very small populations of, settings under the Department of Health, including some camps for individuals with disabilities and some adult homes. And then we have a super small number of settings under the State Education Department, notably not public schools, which I think is often a misconception people have. So we have no jurisdiction over public schools. We have a jurisdiction over some limited schools. So that's kind of a very high-level overview of the settings we have jurisdiction over. I think this is important to share as well. We've shared it with our friends at OCFS because there have been changes to this map. On this map, you will see the Justice Center regions, which may not be the same as, for example, OCFS's regions or OPWDD regions, but these are the regions in the way we divide our work and the management of our work specific for field investigations. The names you see on the PowerPoint in front of you, they are our assistant chiefs for the regions. And I think one thing that's really changed over the past 10 years, when I first came to the Justice Center, when Davin first came here, all of our assistant chiefs were former law enforcement officers. That was how the agency was envisioned. And I think over the past decade, especially under the leadership of our executive director, Denise Miranda, we've really taken a look and said, what do we need to do this work effectively? And certainly there are some former law enforcement folks among our ranks, but the vast majority of our assistant chiefs are folks that have worked in provider settings, have a social work background, and have moved up through the Justice Center. So started as a field investigator, moved on to a supervising investigator, and now might be an assistant chief, which I think gives them a really important knowledge of the day-to-day and how the work is supposed to be done. These people are great points of contact if you have questions about an open case. We'll also make sure after this presentation to share the list of our supervising investigators. Those are folks that essentially run the offices within a region. So for example, in Region 5, we have offices in Poughkeepsie, White Plains, and Rockland. And then we have a supervising investigator that operates or runs those offices. So those folks are often really good points of contact for questions on open cases. And also if you've had negative, or we always like to hear about positive experiences, but I know that's not usually why someone's calling. But if you've had some kind of negative experience or interaction, or you just think something could go smoother in the future, that feedback's really important to share with the supervising investigators and the assistant chiefs. Obviously, Davin and myself are always points of contact, but I do like to reiterate that these folks are closer to the work, know the case better than we do, and might also get you a quicker response. So just wanted to share that and give you a sense of the map as well. So one of the big things that changed with the creation of the Justice Center was mandated reporting. And I think many of you are probably familiar with these requirements. My guess is you received training from OCFS on this, but I think it's always good to a refresher and a reminder who's a mandated reporter. Before the Justice Center, as I mentioned, New York State did have mandated reporting for child abuse, but again, limited settings and limited population. The protection for people with special needs changed that and requires two different types of mandated reporters under our system. So a human services professional, which is a doctor, a nurse, physical therapist. There's a long list in different sections of the law who's a human services professional and a mandated reporter. And those folks are required to report by virtue of their license. So a social worker, there's like a very long list at this point. But these folks, by the nature of their profession and professional obligations, are required to report abuse. So a lot of times we get these reports, certainly from within settings like in a licensed outpatient clinic, but we also will see sometimes if someone has to go to the hospital, for example, a doctor or a nurse there, or whomever, a social worker working for the hospital might make the report as well. A custodian is someone, I didn't make up the words for the statute, so don't hold us responsible. When I hear custodian, I often think of a janitor or someone who's responsible for keeping a facility clean. In our statute, it's people who work in settings under our jurisdiction. So someone who's works directly, has an employee relationship with a provider or a volunteer or a contractor. And we have a lot of guidance and training on who are custodians and how mandated reporting should work.
So Laura, I let you down. I should have advanced to human service professionals.
That's
here
okay.
when you were talking about it. And then here's your custodian slides. So.
Okay. Sure. So I think these are, and we'll be sure to share this PowerPoint as well. No one's getting quizzed on this, but I think those are it's just helpful to know the framework that was envisioned. I think people thought and that it really is a partnership. We rely on everyone on this call to make reports when you see abuse, to be a witness when you're being interviewed. Those are all really important steps to help ensure that abuse is reported. So let's talk a little bit about what's required to be reported, and I think this can be challenging. There's things that I think are clear cut, and all of this is defined in the law, in the social services law, specifically Section 488. If anyone is really interested in some light reading this evening, but abuse is what you might envision, right? Sexual abuse, physical abuse, and I think that it's a little bit easier to know what might be abuse than sometimes when we talk about neglect, which can be a broader bucket and sort of a more, I don't want to say, I just think there's more variables here. And it's, an action or inaction, as you'll see the definition there, that could result in physical injury or serious impairment of the physical, mental, or emotional condition of someone receiving services. And this is a pretty broad spectrum, right? There could be actual harm or a likelihood of harm. An example I can give, we have we've done almost 90,000 investigations in 10 years, so we have a lot of experience with this, but one that we often see is where someone's, and this doesn't necessarily apply in your setting, so I'm just giving a more general example, but someone is required to be on a 1-to-1 supervision ratio. That supervision is not maintained, and an individual gets access to food and they choke on that food. They're ultimately okay, but that's an example where the failure to appropriately supervise someone resulted in injury or a likelihood of injury. And this is the vast majority of our cases, and Davin will talk about that a little bit later in terms of percentages, but I'm thankful to say that we do have serious physical abuse and sexual abuse cases, but they're not the vast majority of what we see day to day. Devin, next slide. So significant incident. And I guess the other thing I should say at the outset is if you ever have a question about should I report this, should I not, we always encourage people err on the side of reporting something. It's not your job at a staff level to decide is this abuse, neglect, or a significant incident. Significant incidents are not investigated by the Justice Center. They don't qualify as abuse or neglect, but can result in some kind of injury to someone. Oftentimes it can be interactions between kids receiving services, adults receiving services. Maybe there's a fight and there's some issues there. Every state oversight agency defines significant incidents slightly differently, and that was really the result of a lot of time and thought by all the state agencies and a determination that all the populations everybody serves are just a little bit different, and we needed to allow some leeway in terms of the definition of significant incidents. Okay, so when to make a report. So we like to say immediately upon discovery. That is a flexible, criteria. I think within 24 hours is ideal just because your memory of an incident is sharper then, and certainly ensuring that appropriate safeguards have been taken. We like to remind folks the Justice Center is not designed to be a first responder. We're not there to respond from a health and safety perspective, but it is our job to let the state agencies know when we get a report so that OCFS in this example can work with all of you to put an appropriate safety plan in place. And our process is pretty timely. We usually send those notifications out to the state agencies within an hour of getting a report, so those things can be set in motion. Although many times they're already happening, right, because the program is already responding to an incident and a report is made to us. Reasonable cause to suspect an incident is the language used in our statute. So again, I think if you have a sense that something happened that shouldn't have, it's better to report it and let us make the classification decision, whether that's abuse or neglect or a significant incident or not a Justice Center incident. The other thing to note is that group reporting is not permitted. However, we do have flexibility when there are multiple witnesses to an event. We ask that one person can make a call and get the appropriate notification number. Anyone who makes a report to the Justice Center receives a confirmation number for making that report. And we do have some flexibility around, when there's multiple witnesses to an event, we don't need to get 20 separate calls on that event. One call is sufficient, but making sure that you get that incident number is really critical. The other thing I'll say is that we have a lot of great resources on our website. If you've had the good fortune to never have to make a report to the Justice Center before and you're a little nervous about it, we do have samples of recorded calls on the website so you can get a sense of the kinds of questions that you would be asked when you make a report. So, numbers. Let's just talk a little bit about the numbers that we see every year. As I mentioned, abuse and neglect and significant incident are kind of the big things that are reported to us. As you can see, we get a lot of reports here at the JC. Last year was, almost 87,000 reports. Fortunately, the vast majority of those are not abuse and neglect, but these numbers hold pretty consistent every year. We usually get between 10 and 12,000 reports of abuse or neglect, which will launch abuse and neglect investigations. We also are required to get reports of death. So there's a lot of misconceptions around our death numbers, but we're required to get reports of death for residential facilities under the Office of Children and Family Services, Office of Mental Health, Office of Addiction Services, and the Office for People with Developmental Disabilities. And those reports come to us regardless of whether there's abuse or neglect involved. So someone could have died of natural causes, an overdose, suicide. All those reports come to us, and we have a dedicated team of nurses and other professionals who review those. And certainly if there is abuse neglect involved, there will be a subsequent or parallel abuse neglect investigation. But generally, it's reviewing those to ensure that there are no quality of care issues. Significant incident, as I mentioned, a lot of those every year. You can see the numbers there, 25,000, really almost 26,000 reports. And then we also get a lot of reports to us that are just not a Justice Center incident. So no matter the type of report that we get, our call center's job is to enter this into our database, to track it, to assign it an incident number, and then to relay it to the state agency. So even significant incident and non-Justice Center incidents are relayed to the state agency so they can take appropriate follow-up action. We also get a fair number of calls where a call center, so you'll get stuff that just has nothing to do with abuse or neglect. People may be making more general complaints or things that don't fall under our jurisdiction, like nursing homes, for example. So this is the hotline number. Again, if you've never had to make a call, that's, I think, good fortune, but there are a lot of resources on our website, and if you're at all nervous or have questions about either mandated reporting or, what it would be like to make a call, these are some resources that are available to everyone.
Laura, I saw there was at least one question.
Sure.
I only caught part of it about multiple reporters. Jen, can you?
Yeah, absolutely. So the question is, if multiple mandated reporters from different agencies witness an incident, are they allowed to be listed in the same report, or does a mandated reporter from each agency need to call in their own report and they can only list other individuals from their own agencies as being witnesses?
So I don't know that I've ever been faced with that exact scenario before. Davin, I don't know if you've encountered that, but
Davin, you're
muted, maybe?
Got muted by the host, Jen. Now I'm unmuted. Basically when we said, especially I think in kids services, you'll have maybe a lot of people who will witness an incident. And we didn't want to have people have to take time away from their day. The point was make sure it gets reported and make sure that all the people who have knowledge of it, witnessed it, are named in that report, so that then the investigator can, start with those people who saw it right away. So there's no requirement that it has to come from each siloed state oversight agency or license setting. It's just that anybody who has firsthand knowledge of the incident should be named in that report so that the investigator knows who to start with.
Yeah, I don't know that I would agree. I don't think I've never been asked that very specific scenario, but that's the goal of it. So I think having that number, and being listed in the report is very helpful from an investigatory process, but it's not the intent of the policy is to require someone from each agency who witnessed it to call.
Yeah. Were there any other questions, Jen?
No other questions at this time.
Is this me now?
Yes, ma'am.
All right. So thank you, Laura. So now now that you know what to report, we're gonna explain what happens to the report. That always helps me to understand things. So as we've said before, and during this second part of this presentation, I will say over and over again, our website has just a ton of resources that are available to you to to help you understand what to report, how to report it, and what happens. And we're just providing a broad overview tonight or this morning. So please do check out our website afterwards. But basically, it all starts with that report from, from somebody who is working in a program who sees something wrong. Sometimes we get reports from people in the community. They'll see some behavior that they think is wrong, somebody, staff member slapping a person, and they will report it to us. So the very first thing we do is we make a classification. Is this an incident that is reportable to the Justice Center, or is it not reportable to the Justice Center? So unlike if you've ever had to call the State Central Register of Child Abuse, you often get like, oh, we're taking this report or we're not. We don't do that because first we have to figure out, as Laura said, do we have jurisdiction over where this incident occurred and who the alleged person was. So if it's determined to be reportable, we'll go over to the assignment. If it's non-reportable, we don't throw it away. We try and find the organization that would be responsible for addressing the situation that was reported to us. So anything that gets reported to us, we make sure somebody takes a look at it and takes some action. So if it's reportable, then we assign it for investigation or follow-up. So all abuse and neglect cases are investigated. The Justice Center doesn't do all of the investigations. We tend to do the ones that are the most serious in nature, and then things that happen in state-operated settings. But it's usually the more serious in nature. If it's not serious, there was an injury, but there was likelihood of injury, then we may give that to the Office for Children and Family Services, and they would do the investigation. But if it's abuse and neglect, regardless of if we do the investigation or OCFS, or maybe a provider agency, the final investigation gets sent back to the Justice Center, and we review all of the investigations of abuse and neglect, and we make a final determination to substantiate or not substantiate. Significant incidents, we talked about that before. There's like 25,000 of those that were reported in 2022. We don't investigate them. We take the information and we give it to the state oversight agency who's responsible for licensing the program, and that would be OCFS, and they will work with the program to follow up on those. So then that's what happens. And if during an investigation, we like people to know what to expect. We understand it can be a charged situation. Sometimes, someone's coming to talk to you about something that was a bad day in the program. Something bad may have happened. And, I think it's also very difficult sometimes to be a subject. People come to this job. I'm sure you come to this job because you want to help young people. You're not there because you want to see, to harm people. So it's hard to be part of an investigation, but it's also part of the job because we owe a duty to protect people in our care from abuse and neglect. So if you are the subject of an investigation, that means you're the person who's alleged to have committed the act of abuse or neglect. You'll receive a letter of notification from whoever is doing the investigation. So if we're doing it, you'll get a Justice Center letter saying you've been named, and here's some more information about finding out about what your rights are, and it'll direct you to our website. Our investigators, I always mean to flip this over. One of the first things that if we're doing the investigation, we do is we get information. We want to find out what the treatment plans are, what the agency's procedures and rules are for these different situations, because that's how we're judging neglect and breach of duty. And then we do interviews with all witnesses, the person, the victim, and maybe some other people about training and things that might be pertain to this investigation. And we will interview the subject as well. As I said before, we have guidance. Everything that I'm saying here is all spelled out in some, really easy to read guidance. It's available on our website about reporting, about the process. And if you are substantiated for an allegation of abuse or neglect, you have the right to appeal that. And we encourage people to avail themselves. It's free. You don't need a lawyer. Sometimes there's information that wasn't provided in real time during the investigation that would be helpful. Sometimes we see people who are subjects of investigations and they don't want to talk to the Justice Center. And we really encourage you to talk to the Justice Center, because sometimes what happens then is, the investigator has to go with the information that they have. And maybe that subject had critical information about the incident that happened that would have changed the outcome of the case. And it does upon appeal, but there's no reason to wait that long. So we really encourage you, if you're part of an investigation, cooperate, share what you know, be honest and forthcoming, and that will help everything. Jen, are there any questions before I go to the outcomes of an investigation? Okay, hearing nothing.
Nope, not yet.
Great. So as we said before, the Justice Center reviews all abuse and neglect investigations and makes the final determination, which is it substantiated or not. The Justice Center and OCFS will look at corrective actions that are taken to make sure that they are taken. And it's important to remember, and this number has been constant throughout the 10 years of the Justice Center, that 32% on average of abuse and neglect cases are substantiated by the Justice Center each year. So we don't have a quota of substantiating. The purpose of investigations are to find out what happened, and are there actions that can be taken to prevent an incident like that from happening again. That's, at the end of the day, what the intent of all of these investigations are, is to make programs safer for people receiving services and staff. So if we substantiate an abuse and neglect case, and in 2022 we substantiated over 3,000 of the 12,000 that were reported to us roughly, then we make a category, because some abuse and neglect are very serious in nature. Those would be the category 1 findings that you see are 1.5% of the findings. And again, this particular pie chart has looked the same throughout the 10 years that the Justice Center has existed. So category 1 is the most serious. That's sexual abuse. That's serious physical abuse with intent to harm somebody, with serious injury. Those people who are put in category 1 are put on our staff exclusion list. They are anybody who's hired under programs under our jurisdiction has to check with us with the staff exclusion list. If that person is on the staff exclusion list, they are barred from being hired. And that is an important protection. It's made everything safer for us today. But it's a very small percentage of all the reports that are made to us. The largest percentage of reports, as you can see in this chart, is category 3, 75%. And most of those have a neglect attached to them. And so what does it mean if you have a category 3 finding? It means that abuse and neglect occurred, but the injury wasn't serious. It wasn't, significant in nature. The intent of a category 3, we send a letter to the subject, to the head of the provider agency, and say that we've substantiated as category 3. We leave it then up to the provider agency to make a determination. What do we want to do? Does this person need to be retrained? Do we need to sharpen, policies and procedures and retrain the person? Or is this the straw that broke the camel's back? But we leave that decision about what to do about category 3 findings and category 2 findings to the provider agency. They know the staff person best. After 5 years, a category 3 finding is sealed. That means that really nobody can look at it, even internally in the Justice Center. And we also can't share category 3 findings with anybody but the person, the subject, and the provider agency, we don't keep a list anywhere of, people who have had category 3 findings. People can't have multiple category 3 findings, and there's no punishment under the law for that. In a typical category 3, in say Office of Mental Health, an inpatient psychiatric center is, it's nighttime. People who are in a psychiatric center are there because they need to have 24-hour supervision. And so the night nurse comes into the unit and all of the staff are sound asleep, and people who are inpatients in the unit are wandering freely around the unit. If it's a category 3, what would have happened is that person saw that, they took action, and they prevented anything bad from happening. But there was likelihood that people could have gotten hold of something and harmed themselves. So we want, in that case, that hospital to take a look at that and see what they need to do to prevent people from sleeping on the job again. So category 2 finding is more serious. That means there might have been, a serious injury to somebody. If it's a category 2 finding, again, we can't share that with anybody other than the provider agency. And those are sealed after 2 years unless somebody committed another category 2 act within 3 years. Then we consider that serious and repeated abuse, and you would be bumped up onto the staff exclusion list. An example of a category 2, we had a residential program serving youth, not a runaway and homeless youth, but it was nighttime. Young person was up in their room. They decided to leave the program, and they leapt from the 2nd floor down to the patio below and broke their ankle. Now, the staff person who's in the residence has done nothing wrong so far, but then the person receiving services came back into the residence in obvious pain, unable to put weight on their ankle, and the staff person did not seek medical care, and instead sent that young person back up to their room where they spent the night with a broken ankle. That's a category 2 finding. And again, we leave that up to the agency to decide what to do with that staff person who didn't seek medical care immediately. The final category is category 4. Those are findings that are made against provider agencies. Sometimes we do that in 2 different instances. We know that abuse and neglect occurred. We may not be able to determine precisely, which staff person drops the ball at what point in time. So what we want the provider agency to do is say, okay, this happened. What are we going to do to put in place to prevent this from happening again? How can we retrain staff? What do we need to do in our documentation? The other kind of category 4 finding is if we really don't expect staff to have eyes in the back of their heads. We understand if there's, not sufficient staffing available, that you may be compromising staff's ability to carry out their duties. So we would, find that as there are some systemic issues, and we would ask the provider agency to put in place a corrective action plan. And I think both OCFS and the Justice Center are committed to taking a look at those and making sure that things are addressed. We've talked about the staff exclusion list. Again, that's the category 1 finding. This is the tool that helps us keep the bad actors out of the system once we, have found out about them. And as you will see, so we have around almost 800 people on the list now, and we've been around for 10 years. So again, it's a very small percentage, but since 2014, when the first person went on the list, there's been over 200 times that somebody who's on that list has tried to get another job in a provider agency, and they've been prohibited from doing that because of the staff exclusion list, which makes New York's service system that much safer and makes your job that much safer. It's not good to be working with somebody who's coming into this to prey upon vulnerable people. I said before that who finds out about the conclusions of investigations is a very limited list of people. It's the providers, the state oversight agency, which would be OCFS, the subject, and then if a family member, has custody and they're a personal representative, they would find out about it. But only these people can know about it. It's not publicly available, and we send it via mail, the United States Postal Service. And as I said before, you can appeal. If you get a letter that says you were substantiated for abuse and neglect, it says clearly in the letter you have 30 days to launch an appeal, and it's a very simple process. You really just have to write a letter and say, I wish to appeal, here's the incident number. But you can also send additional information that you think wasn't looked at or may not have been included. And again, on our website, we have appeals process and guidance available for people. So that really concludes our presentation about abuse and neglect and what's reportable. And this last part is really to make sure that you're aware of all the resources that are available to you on our website. So before I launch into that, are there any questions about, reporting abuse and neglect or what happens to a report?
I'm not seeing it in any at this time, Davin. Folks, feel free to put your questions in chat. Even, we can certainly cover them at the end of the session.
Yeah. I mean, our most important thing is we want to make sure we answer your questions while we're here together. So, resources. We have an individual and family support unit that is available. So if you have, maybe there's a young person that is involved in an incident, maybe they were a witness or maybe they were the victim, and they have questions about what's going to happen and what impact it will have on them, we encourage you to put them in contact with our individual and family support unit. We have advocates who will explain our processes to them. If they need additional referrals, we'll, either work with the provider or work with them to get them information. But you guys have really important work to do. We don't expect you to be an expert on how we do our investigations, so refer them to our individual and family support unit. And you may meet an advocate during an interview. They do sometimes accompany our investigators to make sure that when we are doing investigations that we're not re-traumatizing people. So those advocates are there to help support the victims during the interview process. Hopefully, if we were live and in person, I would be asking this question. Everybody here signed the Justice Center Code of Conduct upon hiring on an annual basis, and hopefully I would see all of you raise your hands, but sometimes people don't know about that. But we do require, the law requires that everybody who works in a setting under our jurisdiction and they have, regular and substantial contact with people must read and sign the Code of Conduct, the Justice Center Code of Conduct every year. But we don't want this to be a read and sign document. We think this is a very important document that if you're reading it, understanding it, and taking it in, you'll be much less likely to be involved in a Justice Center abuse and neglect case. So we developed some online training. It takes you through all the different provisions of the Code of Conduct that you can do. And we really recommend that you do that on an annual basis when you're signing the code, just to bring it back to life. It's an important document. It shouldn't be something that's just looked at really quickly. We also have, as Laura talked about at the beginning of the presentation, now that we've been 10 years into receiving all these allegations of abuse and neglect from all these different service settings, one of the things that we see quite frequently, and it's not surprising, this is human services, and we're working with human beings and emotions, and all sorts of things come into play. But maintaining professional boundaries with the people receiving services, making sure you're in that helpful zone, that you're not in that for reasons that you're not thinking clearly about. Maybe you're like, I don't like this person, so I'm gonna be a little bit more hands-off, and that can lead to an incident of abuse and neglect. Or you can be overly involved, and that has an impact on the service setting for other people receiving services, and especially if sexual relationship develops, that is always going to be the subject of an abuse and neglect allegation. So we want to prevent that from happening. So we have this training that helps bring to life for all the different service settings, different scenarios for people to discuss how would they handle it, what's the best way of doing it, and negotiate some of these tricky waters that we're involved in when we work with people. We have also developed a bunch of tools that are up on our website. We have agency self-assessments that help provider agencies look at all aspects of their program, the physical plant, their policies and procedures, their policy for abuse prevention, and identify areas where they might need to shore things up to prevent incidents of abuse and neglect. And that's a voluntary tool. We encourage people to do it. We have some best practices for an abuse-free environment that we have gleaned from when people have told us about their agency self-assessments. We don't require that be done, but there have been people who've shared that. And again, the Code of Conduct is a very important prevention tool. And then we've developed these specific toolkits. These toolkits have scenarios for training, there's checklists, there's samples of policies like our maintaining professional boundaries. We have social media policies, draft policies for people to consider. So, and these topics that we have are really based on the trends that we've seen in abuse and neglect investigations that we've done. And some of them are, appropriate for everybody. You may not have to secure a lot of wheelchairs and vehicles, but in the OPWDD setting, that happens a lot. But medical emergencies can happen to anybody. And I think it's really important to make sure that staff are trained in recognizing and what to do, because those delays can be very difficult for people. So they're great, and I hope you get a chance to check them out and use them. We've also developed a series of videos. When you bring on new staff, it may be introducing the Justice Center, and there's this agency that investigates abuse and neglect. That might be sort of difficult to do. We develop these short videos that staff can look at and have an understanding of what our mission and vision is, how we support people, why we're in this together, and what to expect during an investigation. They're really short, and they help explain the Justice Center, and it's a good way to introduce us before there's an investigation, and so people have a better understanding. We also have resources that are available to everyone about just disability resources available in New York State and nationally. We've organized them by, areas of life. So education, my child is receiving special education. What are my rights as a parent? What can I expect at a committee for special education meeting? Where are there accessible parks and recreation in the summer? So it's really a great set of resources. It's free. I think it could be helpful, hopefully, to you with some of the youth that you're working with. And this is also one of the best kept secrets in New York State, unfortunately. But we have the trade program, which provides people with free access to assistive technology that helps a person with a disability attend classes, get a job, live in the community. It's everything from, iPads sometimes for communicating, power wheelchairs, and the assistive technology can be covered by insurance, but it can be very expensive. It can be a long process in getting it. So the trade centers can provide people with access to the assistive technology free of charge in real time as soon as they need it. And it's just a great, great resource. So you can find your nearest trade center. They're all over the state, and they will work with you to provide you with whatever you need. And this is our last slide with all of our contact information for reporting abuse and neglect. Maybe you need some information, other questions, and our website is really your best resource. So I'm going to stop sharing now and see if there are any last questions.
There's no questions in yet, so we can wait a few minutes to see if anybody has any questions. But can you guys talk a little bit about so any staff could be a mandated reporter from a couple of different aspects, right? They could be a mandated reporter to the Justice Center, but also in terms of child abuse. And can you talk about sort of that distinction and how somebody knows which one they should be, which report they should be making?
I'll start, Laura, then. So there's really no wrong place to make a report. As Laura said, our jurisdiction is kind of crazy, but if the abuse or neglect happens in your program, and it's the incident happens in your program, that would be reportable to us. If the incident happened while the child was maybe at home, you would call the State Central Register of Child Abuse. But if you call us and we make a determination, this isn't reportable to us, this would be a State Central Register of Child Abuse, we'll do a warm transfer right then and there. We'll make sure it gets there. So if you contact us, you don't have to worry. As Laura said, you don't have to know, is this a significant incident? Is it a category 3? Is it a category 2? That's not your job. Your job is to report it. And if you call us, we'll make sure it gets to the right entity to report.
Yeah, I don't have anything to add to that, Davin. I think the other thing I just wanted to mention that I think is worth noting, because I Davin and I both reviewed the survey findings that Madeline had sent us. Thank you for those, Madeline. I think, as I mentioned at the beginning, I want to make sure that anytime there's an interaction with the Justice Center staff that is less than what you're expecting, less than professional or courteous or respectful, we want to know about that as soon as possible, please, because it's hard for us to take appropriate follow-up action if we don't know about it. The other thing that, a theme I saw in some of the survey responses, which we're already addressing, and I think we'll continue to address over the course of 2023, but we have a designated team of investigators, our sexual abuse response team, that handle our sex abuse cases. Obviously, I'm sure everyone can appreciate these are some of the most challenging cases. They're cases where we're going to have to ask a lot of sometimes uncomfortable questions, but what we want to ensure is that our staff are always doing so in an appropriate, respectful manner, and that we can give everyone a sense of what to expect before an interview starts. So one thing that we're doing is working on an in-depth training specifically for our SART investigators this April. We're going to be working with a Capital Region group in Our Own Voices, which is a group that was recommended to us by OCFS, working with LGBTQ communities, particularly communities of color, and we think that that's really important to ensure that our folks are approaching our work in the most informed and respectful place possible. And we will also be doing a larger training for all agency staff, because I think these are really important issues, and we want to make sure that we're approaching our work from the right perspective. I think the vast majority of our staff have good intent, but sometimes stumble in their approach, and so we want to make sure we're giving them the best tools to do that work. We're also working on just making sure people understand this is a constant struggle for our agency. We have a lot of settings under our jurisdiction, as you can sort of tell from that first slide. I mean, we have a chart, there's probably like 50 different types of group homes or schools, and everybody has different regulations and serves a different population. So it's challenging. Our investigators, our staff have challenging jobs in terms of understanding all those settings, but we're continuing to work to build. We have these little almost like podcasts that we do that talk about the different settings under our jurisdiction, and our goal is to ensure that we have one specifically for one-away and youthless shelters. It's a very specialized population you guys are working with and specialized settings, so we want to make sure our folks have that information before they come in to a shelter and meet with any of you or interview anyone receiving services. So we're certainly committed to that and making sure everyone understands the challenging jobs that everybody has, and dealing with kids with a lot of trauma and a lot of challenging issues. So we want to make sure our folks come in best informed to approach those interviews.
Yes, we're looking forward to a presentation on May 4th, actually, from Madeline
Thank you, Jen.
and other team members to update our staff exactly on your programs and those challenges. Just wanted to apologize. I think what's happened today is that a link was shared, so a lot of you are Madeline. So that's made it a little bit more challenging to communicate. But Madeline, if the real Madeline would raise her hand if she's interested in, all right. Let's see if this is Madeline. I will try to make you a panelist. Is that you, Madeline?
Hi, good morning.
Good morning. Did you want to share anything with us?
I just really wanted to thank you for making this, training opportunity available to our folks. Like we said in the email that went out announcing the training, this can count for 2 of your annual required trainings, the topic-specific ones, as well as the 40 hours. So we do hope you'll take advantage of that for your team. And like it was said, OCFS, along with some of our provider agencies, are going to be offering a training to the Justice Center so they understand the space that runaway and homeless youth programs fill. So this is an ongoing kind of dialogue in both directions. And if you have questions, concerns, anything to do with the Justice Center, the trainers have made themselves available, and we at OCFS are also available to hear them and support you through that. So thanks for being here.
Thanks for working with us, Madeline, and we'll make sure to send out after this the PowerPoint and then the list of our supervising investigators as well, so that everybody has those contacts. I think they're really important frontline contacts for folks.
All right, well, I am not seeing any other questions. You guys did a fabulous job.
Well, certainly, if there are additional questions, and Madeline, if it's helpful, if you get a bunch of questions and want to sort of coordinate those, we can do some follow-up and make sure that we're responsive to those. But we're looking forward to the date in May, and thank you again for the recommendation for In Our Own Voices. So we appreciate it.
All right. Well, thanks, everybody. Have a wonderful rest of your day.
All right. Bye, everyone.
Thanks.
Thank you.